Today we're talking about giving back. I think we all realize the cost and impact of healthcare, one of the greatest slices of the federal budget and a growing economic concern for physicians, patients, and legislators. Over the last number of years, the number of uninsured has dropped, but the number of underinsured has exploded, with rising premiums, drops in coverage, and huge deductibles. Many Americans are finding that their coverage is in name only. The underinsured have potential health care obligations that far outpace their income and savings. Thus, they are left with the options to avoid care or face huge bills that could result in financial collapse and bankruptcy. The largest growing population of the underinsured is the working poor and middle class, those that may make enough money to not qualify for all government services, but don't have the funds to build large reserves for expenses outside daily obligations. These folks are falling through the cracks in growing numbers, facing the choice of bankruptcy or ignoring medical needs. We spent time with two services that help fill in that gap, taking care of patients that may not have the access to the care they need when they need it. We spend time with Surgery on Sunday, a service that provides outpatient surgeries at no cost to those in need. Then we go to the Refuge Clinic, a clinic in service for working, uninsured, or underinsured so they can meet their primary care and preventive health needs. Finally, we're going to shift gears, talk about the recovery from joint surgeries and injuries with Court Physical Therapy, helping folks get back on their feet, advance recovery, and prevent future painful conditions. But first, we start off with Surgery on Sunday.
Surgery on Sunday is exactly as its name suggests. It's a full outpatient surgical service that takes place on one Sunday a month. During their time, they perform 15 or more surgeries in 4 hours in children and adults alike. The clinic is staffed just like any other surgery center, with nurses, doctors, techs, and clerical services. They're all there as volunteers, and the surgeries cost the patients nothing. For many, this service can mean the difference between losing everything and continuing towards that American dream. Dr. Andrew Moore is the founder of Surgery on Sunday and explains how a personal belief became a reality.
I've always believed that we needed to give back to society, and there were people less fortunate in our society that needed help. So I sort of went into medicine with that idea. My father was like that, my grandfather was like that as well. And so I always took care of people that didn't have money and found ways to do that.
Dr. Paul Carney is a highly respected surgeon and the medical director for Surgery on Sunday.
Well, the concept for Surgery on Sunday is a fairly straightforward one. There are lots of underinsured or uninsured members of our community. And no matter how big the reach is of government programs or local insurance programs, you're never going to be able to pay for a lot of people. There's people that just simply slip through the cracks for one reason or another. They're not eligible, they're working poor, and they have needs. They have the same medical and surgical needs that the rest of us have. And Surgery on Sunday was sort of an avenue to provide services for those people to put them back into the workforce.
The key clientele for Surgery on Sunday is that growing population of underinsured or uninsured.
Well, there's no question that patients are falling through the cracks. And when we started this, there was probably about 20% of the state that was uninsured. With Obamacare, that dropped down to about 8.5%. But unfortunately, a lot of people that were on Obamacare, as you well know, have huge deductibles. Maybe $6,000 for an individual and $14,000 for a family. Well, when you have those types of deductibles, you really don't have access to health care because you can't afford the premiums, much less those kinds of deductibles.
The challenge for Dr. Moore wasn't the motivation or the idea, it was making that idea into reality in an industry that is highly regulated, with federal and state laws that seem to make the goal of helping people for free very challenging.
Probably starting, 15, 17 years ago, I made a couple attempts at starting something like Surgery on Sunday. My idea was that most of the ORs are kind of closed down on Sunday, and that would be a good time to do it. But I really didn't have all the talent to really make it happen. And through the years, I eventually surrounded myself with the right people that could take care of my shortcomings and make it happen.
Thankfully, Dr. Moore saw the project through, and now thousands have had surgeries through their services. Dr. Carney tells us how it is all put together on any given Sunday.
It required some infrastructure building in order to do something this complex. So it took a number of years to put all of the pieces in place. You needed a surgery center where you could operate. You needed volunteers who had the expertise to do that. You had to have coordinating individuals that could screen and clear patients and take care of their other medical problems to make sure it was safe for us to operate on them. And then finally, you needed a group of specialists in the surgical fields who were willing to come in and operate on these patients.
The question is why? What is the motivation for Dr. Moore and his staff to give up a Sunday morning to do what they do during the rest of the week, but for free?
There's certainly been times and periods in my life where I needed somebody to help me do something that I wanted done, or needed help personally to accomplish things that I wanted to do in life, and people have helped me. And I feel like I need to do that as well. And the joy that you get out of doing something like this, helping somebody that otherwise wouldn't be helped, it's hard to duplicate that life with other things that you do. I mean, when you leave this place on Sunday, you feel great. If you look around here today, you see everybody's got smiles on their face. They're not at work. They're here doing something that they have a real passion for, and they love it, And I mean, even when I'm not operating, I come over here on those Sundays so I can be around this group of people that are just so excited to be here, and they make it happen. We have about 80 volunteers that are here that make this happen. So there's a lot of work behind the scenes that makes it possible for us to do this.
And as a result, dozens show up on Sundays to provide care for those in need.
Everybody wants to be here, which is great. So today would be a sort of a typical day for us, and I don't know how many cases we have today, but it's around 15 or 16 cases, which is a sort of a typical Sunday for us.
So how big is surgery on Sunday? Every surgery day, nearly 100 volunteers spend the morning providing anywhere from a handful to over 15 surgeries to patients of all ages. Over time, the numbers have added up.
We've been running since 05 or 06, and we've done about over 6,000 outpatient surgical procedures in that 10-year span.
And the cost to these patients?
None. The patients do not pay a penny. So not only do we get their preoperative evaluation at no cost, any diagnostic studies they need are done at no cost. Medications they might potentially need are all done at no cost to the patient. So it's totally free at every level.
Most of these people are hardworking citizens. They're taxpayers. Some own small homes and cars and have families, and they just need that little bit of help to get back into the flow of things, and that's what we're here to do.
To these patients, this service is the difference between potentially insurmountable medical bills and getting back to life or work as soon as possible. To them, it's about family and being a functional member of society.
Most of these people are unable to work, so the family's struggling financially. Sometimes they're unable to take care of their children or other household needs. And again, we get them back into the family situation, and the whole family is stressed out with this illness and sickness. And when you change that, you really change the whole perspective of how that family relates to each other.
Let's just take a simple outpatient surgical procedure. The cost of a simple outpatient surgical procedure, let's say a hernia repair, a gallbladder, or ear tubes for a young child or something along those lines. The average outpatient cost is right around $20,000. Think about that for just a second. $20,000 for somebody who might be making $25,000 or $30,000 a year, can't afford insurance, doesn't qualify for Medicaid. I mean, that's just an untenable financial burden. So we take a cost for a simple outpatient surgical procedure, which may be $15,000 to $20,000. We make it zero for the patient.
As you walk around surgery on Sunday, there are smiles everywhere on the faces of the volunteers, patients, and families. This service is one of the compassions and commitments to people in the community. You can learn more about Surgery on Sunday at their website, surgeryonsunday.org.